There's no antiviral treatment for it in terms of a medication in that sense, but there is supportive care that can be given, and the majority of these patients, or a large proportion of them, had significant respiratory distress and wheezing. So providing oxygen, providing albuterol treatments and things of that nature, and then other supplemental treatments along with asthma. Certainly the risks are higher in children who have underlying chronic disease processes, and it's terribly sad. There's been another reported death as well, since that time. But the majority of healthy children, while some may get critically ill, the majority of them do quite well. It's respiratory spread is what we see with this virus, and it is not atypical for what this virus is atypical in the sense that it's an outbreak, but it's not atypical in the sense that respiratory viruses spread much in this way throughout the country during respiratory viral season. So if you compared it to RSV, we oftentimes will see little sporadic outbreaks and then full-on, expected outbreak as time goes on and more people come in contact with each other. And the CDC has now found and confirmed paralysis or some form of in 17 children across 17 states across the United States. So it's kind of it's all over. They're currently evaluating dozens of other cases. So we expect that number is going to go up. Now, in terms of whether or not they found Enterovirus D68 with those children, they've not found it in the spinal fluid where one might expect it to be. They have found it in the nasopharynx and in the throat in a few of the Colorado patients, but we don't know what that means. We don't know if that means yes, the EV68 is what's caused that, or if that was just there and this was caused by something else. There are several viruses that we know that can cause paralysis. First and foremost, good hand hygiene is important, so wash your hands after you use the restroom and before and after meals. And don't drink and share utensils with after people, which is sometimes easier said than done with children. And do the sneezing into your elbow and cough into your elbow kind of etiquette. Getting your flu shot obviously is really critical at this time of year before the influenza season hits, so you're protected from that standpoint. And the things you need to be looking at in your kid are for the respiratory piece of the enterovirus are cough, plus or minus wheezing, with difficulty breathing. Bring them in and get them seen right away so that they can get treatment that they need for that. And in the other sense, or the paralysis sense, it's more fever. Most of them had respiratory symptoms, but not all. And then about a week or two later, they develop weakness in one of their limbs. Enterovirus in general is a summer-fall organism, so that's when it peaks every year. And typically we go through periods of years where it peaks in valleys. So some years have higher breakout rates and some years have lower. Of course, looking at next year, we'll have a higher population of people that have some antibody because they were either sick or exposed and maybe developed antibody. So it's really too early to tell what might happen next year.